following a normal path for menopause. You know, because sometimes we can brush it off as menopause and maybe there's a problem going on. So it is something that needs to be talked about, but just feel reassured that usually you're 48, you're 49, you're having all these things. Usually we can chalk it up to menopause, okay? Hormone replacement therapy has been a really big issue in the last several years. We used to just tell everybody, once you start menopause, you start your hormones, and you stay on them for the rest of your life because they're a great thing. They help your heart, they help your bones, they help you feel better, so this is what you need to do. Then a lot of studies came out, and a lot of studies started saying, well, maybe they're not as good as we thought. Maybe they're not so great for your heart. Maybe they're not, you know, they are great for your bones, but maybe they aren't as great as we thought they were. And so now what we recommend for women, and I can't promise you that in 10 years we'll be saying something different, but right now what we're recommending for women is if you need hormones, you take hormones. If you are going through menopause and you're feeling okay and you're handling it okay, then you may not have to take hormones. Your body may be able to do it on its own and you're okay. But I don't want you to feel like I'm dying over here. I'm just, you know, every month, I can't even go to work, I can't function. For those kind of women, you probably need to be on some kind of hormone, or you definitely need to be talking to a physician about the possibility of taking hormones. So it's not so cut and dry, whereas we used to just throw hormones at everybody. Now it's a discussion that you need to have with the gynecologist to decide if it's something good for you, or if you're doing okay by yourself and it's something that you can go through by yourself, and then you can do other things to support your bones and to support your heart, to keep all those things healthy. Okay? Any questions?
Any questions?
Are there any other common side effects to menopause outside of hot flashes?
Yes. So the two biggest things would be hot flashes and mood swings. But there's also insomnia. You fall asleep, you wake up. Or you can't fall asleep, and when you finally do fall asleep, it's a fitful sleep. You're hot, you're cold because you can have night sweats. Vaginal dryness is another one because estrogen is responsible for lubricating the vagina. It's also responsible for your skin and your hair, so you might notice that your skin feels drier, that your hair is thinning out and falling out. We can chalk all those things up to menopause. Decreased sexual drive, chalk all that up to menopause. And there's really, you know, even women who take hormones, there's really nothing that can truly 100% replace what your body was doing. So hormones help, but they're not going to make you feel like you're 30 or 20 anymore. But they definitely can help with some of the symptoms.
You said hormonal therapy, and with menopause having the mood swings and the hot flashes and the side effects, then you get on this hormonal therapy. What's the side effects from that?
Well, the reason that we don't necessarily recommend that everybody take hormonal therapy is that there is a link to breast cancer. It's not a big link, but for a lot of us, just hearing the word breast cancer is enough to have us running in the other direction. So that is something that you have to consider, especially if you have a family history of breast cancer. It's something that you would want to weigh in your decision to take hormones.
Okay, thank you.
Yeah, I heard that, and this might just be hearsay, that for African American women, to detecting breast cancer is different because of the density of our tissue behind in our chest, you know, right behind our breast. Is there any truth to that? Is it hidden somehow more for us than other women?
Well, not necessarily for African American women, but any woman who is busty, that could be said to be true for. And so it is important to, along with you doing a self-breast exam, along with seeing your doctor for a breast exam, you do need to incorporate a mammogram because all those things work together to